Hi, I'm Joe Sasson, Executive Vice President of MedAxiom Ventures. And with me here today is Dr. Jerry Blackwell, the Chief Clinical Officer and Executive Vice President of Ballad Health in Tri-Cities, Tennessee. Dr. Blackwell, thanks for joining me today.
It's a pleasure to be here, Joe. Thank you so much.
Thank you. I always love our conversations because I know that your program is always doing cutting-edge things. Can you tell me about some of the things that you have happening right now?
Sure. So it's an exciting time for us. As you know, I've spent the last 20 plus years in single specialty cardiovascular services practice that we've worked closely with MedAxiom, been very helpful. But 2 months ago, our two major health systems in the region merged to form Ballad Health. And so I made the transition from president of our cardiovascular services group to executive vice president and chief clinical officer of Ballad. So that has obviously caused is a different job description for me with a different perspective, have a little bit more global perspective. But what we hope to do with this merger and what I'm doing right now is to really drive value into our region. We serve an area of almost 9,000 square miles, much of it regional. And so this transition from fee for service to fee for value is crucially important to our region. So we have a number of initiatives that are being teed up to try to drive value into our system.
Can you tell me about any one of those that's really standing out that you're currently working on?
Sure. So without trying to generate too much sympathy here, I would tell you that our practice in our region, we actually serve the second lowest Medicare wage index area in the United States. So we've needed to be lean and efficient long before it was cool, if you understand.
Yeah.
But it's even gotten amplified here recently. So one of the things that we're looking at is partnering with industry to see if there are creative, innovative strategies where working with industry we can drive even further value into the system. So we're doing a project right now with Philips Volcano related to interventional cardiology, where the notion is that between industry and a large healthcare system, that perhaps we can look at something other than just the cost of supplies, but more broadly look at outcomes and risk sharing between the two entities.
That's fantastic. You know, I think that a lot of times what we see out there from some systems and some practices is how do we simply turn down the dial on price, right? And instead of saying, what is the goal of the future? What is the goal for our patients? What is the context of the new healthcare environment we're in? And how do we partner with industry to do something novel? So I love that you guys are doing that. That sounds fantastic. Tell me what the outcome of that kind of initiative is going to be. You said there was going to be risk sharing involved. Is there quality measures associated with that, cost measures? Can you tell me about that?
Yeah, it's actually all of the above. So it's clear what the cost of, say, a particular device is. That's the way that we've dealt with things in the past. Here's what a particular device costs, here's what the system's going to be charged, and here's what's going to happen. In this is much broader. I mean, we're looking at clinical, operational, and financial aspects of the entire thing. And it's interesting how closely those three things are linked. So we hope to take something such as intravascular ultrasound, FFR, IFFR, and link what happens there with actually operational improvements inside the cath lab. So it really will be a global approach to this, looking at readmission rates, looking at complication rates, looking at total cost, which is crucial to the healthcare system, okay, not just a device, but total cost of care, supplies and labor, and then of course we'll look at some standard measures such as same-day discharges, et cetera. So it's the whole enchilada, if you will.
It's the whole thing from even before you get into the cath lab to the entire process through, and making sure that you're adding as most value as you can to the system and to the patient, especially to make sure the right care is given.
Exactly. So I don't want to speak for industry completely, but it's clear how both benefit there. I've just described from the health system's point of view. From industry's point of view, if they partner with us, we use evidence-based guidelines to use particular devices or therapies that are known to be effective. Then the more we utilize those things in an attempt to reduce variation in care, to lower total cost, then it benefits the healthcare system. The increased use of appropriate devices and technologies is an advantage to industry. So it needs to be a win-win situation. The two organizations have worked together extremely collaboratively. It couldn't have been any better, actually.
So My question for you is, once you decided and had some organizational alignment around this is something we want to do, and we actually want to move forward with a risk-sharing model like this and partner with industry in a new way, once your organization made that commitment, how long did it take for you to get up and running in such a program?
Yeah, it's a great question, Joe. And was actually quite easy. This is something that we got up and running in a matter of 2 to 3 months.
Oh,
So
wow.
again, there's a commitment on the front end, but and the communication is crucial. But as far as getting started on it, it's really a matter of only a few months.
Excellent. So reducing variation, using evidence-based guidelines, it sounds to me, because you have a very sophisticated system, but from my impression here, it really, those are such standard practices, or should be, that although you had the time to get the buy-in, anybody could really participate in this if they had the right characteristics and the right culture to be able to take that risk and be able to change their operation. So is there anything that you think will make you successful in that, or for other practices? Is there, certain characteristics where you say this would fit this environment but not another, or is it really universally applicable?
It really is universally applicable, but communication is the key. In other words, you have to start with the why, if you will, to explain to the principals why this makes a difference. From the point of view of the hospital, I mean, and put yourself in the position of a chief financial officer, there's two things that can make a huge impact right away. One is lowering cost of supplies. But the second, and this one is less clear to folks though, is reducing variation. And so these are really common sense things. And actually, once you communicate to the providers, it makes perfect sense to them. So beginning with the why and then communicating about it makes it applicable to anybody.
Wow. Well, thank you. I really appreciate it. I know this conversation could probably go on forever, but I really appreciate you sharing at least that one initiative with us. I think that's fantastic. And I hope you enjoy the rest of the MedAxiom conference.
Well,
thank you for being with us.
Thanks. We've learned so much in MedAxiom through the years, and happy to help and pay some of this forward.
Appreciate it.